and really excited that we're going to have a wonderful discussion here today with Dr. Russell Mowat and Efrat Pfefferman of United Way. And before we start,
are we having Mark freeze up?
we're going to have Efrat may be jumping in cases of instability. Am I up now?
Yeah.
Okay. All right. Sorry about that.
Sorry about that.
So one of the things that I want to be able to bring up is that we have a chat in which we invite everybody to introduce themselves on chat so that we can all see who's here and who's joining us. I see that we have about 44 participants with us today. And so I like to encourage everybody to introduce themselves, say who you are. And during the course of this discussion today, feel free to use the chat as a means of engaging with other participants and to talk about a lot of the very things that we are having here, to present different ideas, share resources. We do ask, of course, that you engage with curiosity, not with hostility, and to be able to carry on in a productive manner. Beyond that, we also will have a Q&A period. And as part of the Q&A period, we also ask that you will notice that there's a Q&A box down below. Please use that as a means of submitting your questions to the panelists. That way it'll be easier for us to be able to see what kind of questions that we have that are geared specifically towards the panelists as compared to the chat that we are engaging in. So, and also it will be more effective if you give the panelists the time to be able to introduce themselves, talk about some of their core themes before using the Q&A button, probably towards 8:20, 8:30 or so. We'll be paying much more attention to the Q&A to see what kind of questions we have for the panelists that we can present. So I also want to, I don't want to miss an opportunity to thank the sponsors. First of all, my name is Mark Fraley, and I am the Associate Director of the PACE program at IU. That's the Political and Civic Engagement program at Indiana University. And we are proud to be co-sponsors with United Way of this event. And I also want to give a shout out to the Bloomington Board of Realtors, as well as the Bloomington Chamber of Commerce for their support of the Wake Up series and today's events. So I want to start by allowing everybody, all the panelists here, to have the opportunity to introduce themselves and talk a little bit about some of the work that they do as well as the research that they do. So starting with, and I'm just going to go based on how people appear here on my screen for simplicity's sake. So I'm going to start with Dr. Mowat, if you'd like to introduce yourself and talk a little bit about some of your work.
Yeah, Russell Mowat, professor in the Department of American Studies, as well as in Department of Geography most recently. So now I'm split appointment with those two areas. And so instead of actually really talking about work, I'm going to try to talk about conceptual sort of thinking, spaces. And so, so just prepared a piece for us to sort of consider overall. So the present circumstance just doesn't work. And if you don't mind, I'm going to also share some slides. Is that okay?
Sure.
So this does not work as in the way the society functions. What has been brought to bear upon us is this confluence of environmental over-extraction, the privileges of global travel, disease, and inadequate public health system, exploitation of labor, disposable populations, and the role of policing both in policy and through functionaries. All this weight on our psyche is necessary, but is also what understands the basis for this wake-up event. But this weight has prompted others to take action or more action on matters of injustice, state violence, historical patterns of discrimination, social determinants of health that greatly impact population of color and of poverty. And this is why we're hearing from the streets calls for reform in policing and representation, and for abolition, both police and prisons. What I wish to briefly tease out are maybe some reasons for these calls, their promise and their shortcomings, both. But in all, keep in mind the status quo does not work. The status quo is not effective and is harmful and unsafe. In terms of reform, restructuring, reconceptualizing the institution, many are aware of this, as it tends to just be a revision of current processes and departments that maintain harmful intent. At the heart of some reform approaches, evidence-based decision-making. Many of the laws, policies, or procedures that are developed rest on either one, poorly interpreted data, or two, only anecdotal evidence. School closures based solely on test scores, hospital beds cut for cost saving, specialized park programming for youth, but only a small segment of youth, police equipment purchases to increase lethality under loose measurements of safety. This is why some are forcing cities and states to open their budgets books to look at spending, not just on policing, but all aspects of governance. But at the height of other reform approaches are opportunity or opportunism. There are now cottage industries for trainings, implicit bias, diversity, mindfulness, and even yoga all have a zero effect, no proven relationship with either better crime solving or public relations. Some calls within this criticism have even argued for better pay amongst police, expenses given for moving into communities, and incentives for good policing. We can easily extend these approaches to universities, private businesses, and other social services. The whole aspect is to get a trainer. Abolition, however, is ending and reconceptualizing society overall, but this is not an easy feat and may need to be taken in several steps. At the heart of abolition is trying to reorder or rethink the world, beginning at the local and moving to the national and global. Why do we have prisons? Why do we have police? Why do we have schools? Why do we have parks? Why do we have hospitals, etc.? In some cases, something can be altered in order to return to the original intent. In other cases, something has to radically change because of the original intent. Schools were founded on the noble idea that education should be right for all and free at the point of delivery. So why not extend it? Police, however, were not started on the noble ideas. This fails to be confronted in any discourse on the news by government and many others. But at the heart of abolition as a criticism is the long road. This requires working towards something over time with immediate steps taken in moving towards this new world. Priorities have to be altered, but also reordering has to occur. The society in which we function has long been comfortable with killing people with impunity, locking people up in a way out of sight for eternity, closing schools without consequences, and seeing poverty, not something experiencing homelessness, and doing absolutely nothing about it. We can conceive of things like broken windows policing, 3 strikes, organized abandonment, and we have many different decades of failures of other types of policies. All of these and others have come to bear at the same time during this era of COVID-19. For this discussion, I hope we sit with the problems for a little bit and then entertain a discussion free of constraint. It isn't like any of us control city budgets. So in closing, there was once apartheid and then there wasn't. Thank you.
Thank you so much for those thoughtful words, as well as the slides. I thought the visuals were an incredibly powerful accompaniment to the words that you stated. So thank you very much for that. Next, I want to go to Dr. Simon, if you'd like to introduce yourself and talk a little bit about some of your work.
Morning. Thanks for having me, and thank you, Professor Mowat, for having set the stage for this discussion with those very moving visuals. I'll first introduce myself and then talk about some of the what I could add to the discussion, perhaps. I'm closely assigned professor in the O'Neill School of Public and Environmental Affairs. I'm also the Associate Vice Provost for Health Sciences for the Bloomington campus. I'm a health economist who studies government policy, and my work has been on how policies that attempt to make things better in healthcare have effects on health and healthcare outcomes, but also have some unintended consequences that policy should pay attention to. So mostly I look at the Affordable Care Act. I've studied the opioid epidemic, and for the last 3.5 months, my work has been entirely on the impact of the COVID epidemic on jobs, and because that was where we would first get the data, and now on more other measures of economic well-being, including healthcare. So what I want to add to this is that, largely there's a huge discussion and concern and need to address issues of racism from points of policing, acts of brutality, racist attacks. I want to set this context, though, that there's very large outcome differences that stem from many sources, including all of these above, but are also from compounded historical disadvantages. So I'm going to talk about economic and health settings that have been different, inequalities that have been around for centuries, decades, and some are getting worse in recent times, even with policy and so much attention. So that's sort of what I see as a wake-up call, is that even if we talk about these as that are centuries old, we have this sense that, oh, it must have been getting better since the turn of this century, thinking about all of the, we've had administrations that have put forward anti-poverty policies, such as reforms to the Earned Income Tax Credit that have advanced it, the Affordable Care Act. So where are we with health? And I'll end is that shockingly, some of these, economic gaps are increasing, not narrowing, and the same can be said for some health outcomes gaps. So again, wake-up calls all around. Just to put some numbers around this, I'll start with thinking about median household income. I'm going to use numbers for real median household income that come from the Economic Policies Institute. They are all different ways of trying to calculate, adjusting for inflation, but just so I know, this is, think about year 2000. Real median income for a Black family, $43,000. Real median income, household income for a white family, $67,000. That's more than half greater, more than 50% higher. That looks bad. Surely we know we've had lots of economic growth since the year 2000. We had the recovery since the Great Recession of 2007 to 2009. What's it like more recently? So the latest economic statistics from the Census Bureau are really for 2018, 2019 numbers, not yet released, but think about this as pre-COVID, worse during this pandemic, but pre-COVID, it's actually a larger, in real terms, $42,000 for families and $71,000 for white families. So now the gap it's from something that was 50%, it's a 70% gap. So in many ways, the gap in income has there has been no narrowing of that, and that's worrying because that was during good economic times. So now we come to Europe, and what my work has done is look at what's happening in job disparities and in reemployment disparities too. So in April, we saw from March the largest, losses of jobs that have been on record. The losses of jobs were greater for Hispanic and for Black families, other groups. And during May, we've seen a little bit of a reemployment of some jobs that were lost, being calling back workers. And when we study that phenomena, there also even though the job losses were greater for Latino, Hispanic, Latinx families, Black families, the gains back to employment are slower. And this is consistent with research from the Great Recession recovery, actually, that economic recovery, economic decline, so during recessions, it's much worse for minority populations, and the recovery is much slower. So this bodes ill. There's also lots of other evidence from surveys that are being conducted now that are showing food insecurity, food insufficiency, all sorts of well-being measures, housing security, all are worse among populations that are very vulnerable. I just want to set that as the stage. And then there's also of health outcome statistics that I could go into. I'll just point to a couple of them. Infant mortality, the gap right now between Black and white infant mortality is shockingly high still. Infant mortality for Blacks is 2.2 times greater than it is for whites. And that's actually after an improvement, because 10 years ago, it was 2.5. So we think about it as that has been moving in the right direction, but it is just a shocking gap still. When we look at things like diabetes, hypertension, and asthma, no matter how you measure it, for Black families are just much higher. So we can talk there too. There have been some gaps. There have been the life expectancy gaps have also been improving with infant mortality, but still remain incredibly high. And there are, in some areas like diabetes and hypertension, signs of increasing gaps. So all this to say there's a lot that is rooted in history and shockingly still present, and in some cases growing as disparities. So to add to all of what we are currently seeing as in the policing and attacks are these economic disadvantages.
So thank you so much for that sobering information, but certainly very important to know. Next, I want to turn to Efra. If you want to take the chance to introduce yourself and talk a little bit about some of the work that you're doing with United Way.
Thank you, Mark. And I'm humbled to be part of this panel of brilliant individuals that bring all of this information, perspective to the discussion here today. And I know moving forward, you'll continue to do so. And I'm also just looking at the list of names here and just want to say hi to everyone and appreciate you being here early in the morning. I miss all of you. Look at all these names, partners from our nonprofit agencies and local government and IU and volunteers and supporters. So good to have you here today. I'm Efrat Pfefferman. I'm the Executive Director of United Way of Monroe County, and delighted to also be joined by several of our staff members. Particular shout out to Jen Hoddle and to Catherine for helping run today's tech side of things and communication side of things, and also joined by several of our board of directors members who we all work together to lead the organization and to further our mission. United Way's mission is to address our community's critical needs today and to reduce those needs tomorrow. And we do that by organizing collective efforts, including giving, advocating, and volunteering. And that's a really broad mission to address our community's most critical needs, because needs change. Every community is also different in what their particular needs are. And so ours are ours to own and to address. And the past, I'll say the past year or two, we have really been flexing this muscle at United Way. Not just with COVID, but I'm thinking back to beginning of 2019, we had the federal shutdown, if you'll recall. And so we not only had furloughed employees without paychecks for weeks on end, but we also had our food security, the SNAP system disrupted because of the payment from federal to state, and we worked on that. June of last year, so just over a year ago, 4 tornadoes hit our region, and 60 households saw their homes destroyed completely or partially. That took a targeted effort to help those from moving into further instability or homelessness. And then March of 2020, as the pandemic bursts open, people are laid off, hours reduced, schools shut down, placing pressure in the homes of families. Our elderly, our individuals living with disabilities, who maybe were already homebound, are facing new struggles of how to find, how to meet their basic needs. So we'll talk a little more about these disparities we saw right away. But we also saw our safety net face, I hate the word unprecedented by now, don't you? But I don't know what other word there is. Unprecedented challenges for our safety nets of increased demand for services, for basic needs like food, shelter, healthcare, just as the ability of nonprofits to hold fundraisers was disrupted, and their ability to deploy volunteers and staff was disrupted with the need for social distancing. So in partnership with the entire community, we launched the COVID-19 Relief Fund in mid-March to help assure that our safety net was as strong as could be, and that our nonprofits would have the resources needed to adapt their operations as they continue to serve our most vulnerable. Our community quickly responded with amazing generosity, and to date, we've raised over $1.6 million and distributed almost 1.4 to sustain dozens of programs, including food security, safe shelter and housing options, personal safety and healthcare, including mental health and recovery services, and much more. And now racism, not that we haven't, the racism that our Black and brown brothers and sisters have endured for centuries, coming to an even brighter light in the age of technology and social media, as well as research to bear, and the collective movement that we're seeing to address this. Racial justice has long been a value of United Way's, but I'll be the first to admit that articulating meaningless without action, and that's the task ahead of us. Where race and income and their intersection are barriers that keep individuals in our community from the pursuit of liberty and justice. The pandemic really has exacerbated this for many. I was looking back at some materials, and actually Vox Booker shared something with me a while back as he was advocating for housing as a human right, stemming from the work of the county's housing commission. I don't know if you're here today, Vox. I suspect you might have some other things going on. But I pulled this quote out because I thought it was really powerful from his email. Our individual abilities to withstand illness are influenced by a host of socioeconomic factors, and the truth to be reaped from histories of contagion response is that we're only as strong as our most vulnerable. So I wanted to share that in framing. I also wanted to introduce the ALICE acronym and use that a little bit when we talk about economic justice. ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. And there have been a series of reports by United Way, in Indiana, United Ways in particular in our state, the ALICE reports, with a recent one using 2018 data. So it's not capturing the pandemic, but so ALICE households and individuals, they're working, often more than one job, but have little savings to weather storms because the income, especially as we'll see here in a minute, Wages have been stagnant while costs of living have continued to rise. They've risen disproportionately to other goods and services, the costs of housing, transportation, food, healthcare. And so ALICE families are not eligible for federal programs like SNAP or Section 8 because they are just above that poverty line. But again, that one storm can send an individual or household into a spiral that's hard to get out of. And while 1 in 5 in our community is in full-blown poverty as defined by the federal government, ALICE households teeter right above that line and comprise another 1 in 3 households locally. That's nearly half of our population that's either in poverty or teetering right above it. And within the ALICE population, certainly Hispanic and Black households are overrepresented, as are young households, those headed by someone under 25, and single female headed households with children, especially, are in that category as well. We don't have data on individuals with disabilities, but we know that's another population that has been disproportionately impacted by this pandemic. And so, again, the data from ALICE is pre-COVID, and we don't have it yet for the moment we're in, but we know from past disasters that they do affect ALICE households disproportionately. And if a family is already without a financial cushion and lacks job security, they're going to suffer right away. They're going to struggle to repair damages from a disaster. They're going to struggle to recover from illness. They're going to struggle to pay ongoing bills. ALICE are often essential workers too, and have to choose between caring for their families and ensuring our community's recovery. And this all puts ALICE families in increased risk for harm during a public health crisis as the one we're experiencing today. So I'm going to use that language of ALICE to really capture this demographic, but just wanted to frame that a little bit before we continue on with the discussion.
Thank you, Efra. And I want to apologize again if my internet cuts out at some point during this. So just try to bear with me. But listening to all of our panelists, you know, it's really sometimes disheartening and sometimes inspiring to actually hear in cases of what is it that we actually need to do to envision a brighter future. As a lot of the things that Dr. Mowat was talking about, what are some of the policies that might help us get out of the situation that we're in, and what are some of the things that we have to think about when we are, some of the potential consequences or consequences of those policies, as well as what can we do on a community level through works of organizations like United Way in order to be able to reach out to families that are certainly struggling, particularly during this time. So I want to see if I can just get a little bit of a snippet, kind of bringing all that together. Since, you know, the theme of this discussion is building a new normal, what does a new normal look like? What does if we have the ability to be able to do everything that we wanted to do and have a society that looked as just as possible, what does that new normal look like? What are some of the policies that we should be thinking about now in order to get us to that new normal? And what can we do as participants in our community to help move forward in those goals? And so I'm going to, so I'll start with Dr. Simon on this one, if you'd like to share some of your thoughts.
Sure. So on the health side, I think it's thinking about strengthening, not weakening the through the Affordable Care Act, the Medicaid and marketplace options. I think I'll comment particularly on health care first, just because these are things that we think currently, like numbers and are not showing big declines in health insurance right now, but I think this is one of the things that's a lagging indicator. Like it ends, and then when it happens, it's hard to know, well, where are people going to go? So making sure that there are those options for health care aside from just through employers. There's Medicaid, and which in Indiana is the Healthy Indiana Plan, and the marketplace options that always get a lot of play. They're constant threats and back and forths on that, and there's a lot to engage in there. I think a set of uncontroversial policies will be about job training, job retraining, making sure that systems that match skills to employers and provides all of that skill and equipping populations to make sure that there is job assistance is an important policy that there should be a lot of support for. So I'll just throw those two out. There's a lot else, but get started.
Fantastic. No, thank you so much. And as we go through the other, I want to remind the attendees to feel free to use the Q&A button to post any questions that you would like to the panelists, and we'll be monitoring those as well. Dr. Mowat?
Yeah, I think, at least for me, before sort of jumping to sort of maybe some bold new policies, I think an approach to take is to just try to imagine and also work on removing aspects of lethality in the society. So one of the images that I had was just a sign in regards to being in a sort of public park, either at night or some other off hours structures, and violators will be prosecuted. Well, of course, playing at night, especially basketball, may be annoying for neighbors, but why does it need to be punishable by whatever may result in serving time or possibly losing your life through an encounter with the police? And small things that we could do to make sure that we're removing aspects of lethality in the society. And specifically in a place like Bloomington, this could be very well be possible. Some aspects of people who are advocating for police abolition also discuss this idea of disarmament. When you look at what police are typically called on to do, or what jobs they perform, traffic control, construction site supervising, why do these need any particular type of equipment that results in, immediate loss of life, even though equipment does not necessarily mean that's the only way someone can lose life, because of course we know in Minneapolis, it was a knee and not necessarily a particular assault rifle. And so I think that's just at least a quick response that I have, is that can we remove these aspects of harm producing by government and social services in certain ways? Can we just remove these things? And I think if we remove the lethality, then we can now entertain discussions of what are maybe some more hopeful and imagining types of policies.
Excellent. Thank you very much. Efrat?
Yeah, thank you. There's a lot I could say here. I mean, I made notes about things like housing as harm reduction. We saw the vulnerability of people experiencing home in recent months with the pandemic, and creative solutions like hotels being used to put them somewhere safe. And we know when someone is housed first, then they can address other needs that they have. I wrote down things like universal basic income policies, childhood education that's affordable and accessible and quality, other pay equity initiatives, and capacity building for elected office and local leadership. But I wanted a little more on, I guess, from the world of philanthropy and how it could change and how it is maybe changing, because I think that's been one of the things that from United Way and other charitable organizations like foundations, learnings over the recent months has been to examine how we're in the way or not in the way of things like mutual aid, of grassroots efforts to fill gaps and needs of families and individuals, and to acknowledge that historically world has kind of been rooted in the white moderate mentality that Dr. Martin Luther King Jr. referred to in his time as maybe the greatest threat to justice. And I have I'm looking at a quote from an article that recently came out from that talks about this and kind of blasts our world of philanthropy for our reluctance to fund Black, Indigenous, other communities of color-led organizations over decades that has contributed to all these problems. Our white moderate disdain of funding advocacy and systems change work that has let the fire spread unchecked. The discomfort with saying things like white supremacy and slavery and reparation, insistence on order and bureaucracy through grant applications and budgets and deadlines, dismissal of solutions proposed by marginalized communities in favor of those proposed by educated white elites, gravitation toward long timelines at our convenience, these things that make us part of the problem even as we look to help solve problems. So I think this is something we've really examined in our world, and will change how we do things, and already has. So I think that's, yeah, I just wanted to bring that sort of more systemic approach from the world of philanthropy to the discussion too.
Yeah, excellent. Thank you very much, Efrat. Again, if there are, I see that we're starting to get some questions coming in, and so, you know, we have a question from Kara Crothy about saying, and I hope you don't mind, I'm going to read, Kara, I'm going to read this fully, saying, I am a public defender and am interested in what Dr. Mowat said about evidence implicit bias training is not effective. Can you expand on that? Also, when we are talking about deconstruction and restructuring, could we discuss that relating to our court system? And since Dr. Mowat was specifically mentioned in the question, I'm going to start with him.
There have been several studies. I mean, of course, implicit bias as a concept has been with us since the late 70s, early 80s. But then, of course, there was the implicit association test that really was developed, and it really sort of moved into then an industry in which people were looking at ways in which to either test their employees and then have a discussion about this. People pushed back at that time with the sort of notion that there cannot be an association made between implicit and explicit so-called racism, right? And now in more recent times, especially since probably 2016, there have been ample studies that have completely, shown this, including the initial creators of the IAT, where they have shown that a person even taking the test the same time, or the same test, different times, do not arrive at the same score. So one, the test itself is not reliable in sort of testing what it's saying it's testing, but also two, there's not a way in which what's being tested associates to actual action. So there's actual now, police officers who have tested low in what are the IAT points have actually committed, certain particular cases of infractions or complaints. And so there have been studies, I can't cite it off the top of my head in terms of, in terms of its response, but that's how there's been evidence to show that. And then there's other, just stronger sort of discussions of where actual sort of actions of occur or other types of bias or discrimination may occur. It does not come from some sense of just the sort of internal, there are actual structures in place. I think the biggest thing that people try to push for is move away from the officer, move away from the attorney, or move away from the teacher, and to think of a system, right? There is this that sort of incentivizes, creates, or pushes the need to enact certain things. So, for example, with Breonna Taylor in Louisville, the attorneys down there that represent the family have found that her apartment complex in the neighborhood that she's lived in has been targeted for gentrification. So this has been occurring since that sort of intent to redevelop that area to, in a sense, probably clear that area. So this is why then an entire assault unit is unleashed on to her, not only property, but her floor late at night, even after another assault unit actually arrested the individual. And so this is how people have sort of kind of settled the implicit bias part. The only thing is, I think the general public just doesn't have a sense of that, right? Some of those criticisms and additional work. So I hope that answers the question.
Excellent. Thank you. Do any of the other panelists have anything to add? I do see that there are folks that are on that are recommending resources down there at the chat, including the nonprofit AF resource. And so for those who are watching, please pay attention to the chat. It looks like there's a lot of discussions, good discussions, and feel free to provide your own resources that a lot of us can kind of look up to and edify ourselves as we're going through this process. One thing that occurs to me too, Dr. Simon, you sent out some of your initial resources about some of the things that you were talking about, as well as in your initial statements today. You talk a little bit about vocational training, and the importance of vocational training, how little we spend in the United States compared to everywhere else. And, I think that there are so many different issues, it seems like, that are a part of this large piece of the puzzle that don't necessarily always get a lot of attention, right? There's not always these, that you're not always hearing about through on the regular cable news channels, So what are some of these things that we need to be thinking about? And I'd like for you to expand a little bit on the vocational training aspect, but what are some of the things that maybe are not necessarily captivating the minds of mass audiences right now that we should actually be looking at, that are taking part in our communities, and that we might have a role in helping out, despite the fact that they that they might not be as popular?
Yeah, so on the topic of vocational training, so the US as a nation just spends very little compared to other countries on this aspect. So in the US, it's about 1/20th of a % of national income that is spent on vocational training. And comparison, other industrialized nations are spending about 10 times as much as a share of their national income. And so that's one area where in many other countries, it's seen as, oh, we have this much more robust public funding towards vocational training. And those have been, in other countries have been proven as effective in making job markets function better, because underlying it is this factor that access access to educational resources, extremely unequal, given, not surprising, the differences in wealth. So even larger than the income differences that I mentioned are differences in wealth, because there is much more of a historical buildup to income. So that's, again, something to be aware of, as why is there a need to make sure that there are avenues for mobility, other things that people that might not be, again, until there was research, one couldn't have been sure of these things, but we guessed there was a lot of lack of mobility in society, in thinking about how where you are, there's certainly increasing mobility. So not to downplay that it has become a more mobile society, but there are very, very strong still these ties to what circumstances you were born into in terms of resources. So thinking about what are ways that reward advancement and improve through jobs, because ultimately there's a lot that is dependent on political will to make redistribution happen at the final stages, by which I mean thinking about final incomes. But there seems to be more political will, perhaps in the investments. So I'm thinking about job retraining and education as places perhaps that there is more to think about, and things like retraining.
Excellent, thank you. Wonderful. Do our other panelists have anything to add?
I think so. I'm picking up on, if I recall, the question was what are we not really talking about? That's okay. I'll give that some thought. I'm also wondering if the audience has anything to add in the chat box. I mean, I think I personally am always hesitant to credit our current administration with much, but I will say that the income support that has been given to individuals during unemployment, while it's not been perfect and many have been left out of that, I think it's an eye-opener for us on ways that maybe we can support individuals during tough times. So kind of back to that universal basic income concept, because it's really prevented a lot of things from getting worse for those families that are receiving some support right now. And consumption is down. Consumption of goods and services. So that's helping families and households put that income towards needed things. And I think, things like that are like the extra investments right now in our childcare system. It shouldn't take a pandemic to bring all of this forward, but it has. And it's in my opinion, been a good thing that we need to examine how to institutionalize those things moving forward, so that when we're in a vulnerable point in our lives, whether it's temporary or long-term, these things are there to support us.
Excellent, excellent. So one of the things I'd like to get to, and I know we're coming close to the end of our time, but at the beginning of your introduction, Dr. Moat, you talked, trying to really reimagine everything from the local level to the state to the federal, like kind of working up. And then I know Efrat too, you as well do a lot of work in the local community, and we're all part of local community efforts. And I also see that we have a number of our local representatives here with us today. And, thank you so much for being with us. I see, Penny, I see Jeff and Jeff Bradley, a number of people in county government, especially, who are here with us a lot. And so want to use this as an opportunity. I don't mean to pick on you guys all the time, but one thing I do want to do is ask, what are some things that are local officers, whether in the county council, county commissioners, city council, school board, what are some of the things that we need to be thinking about as we re-envision our future and move to a new normal? I'm going to start with Efrat this time.
Back to some of those things like the housing issue, housing insecurity, and finding creativity in solutions. I mean, we're all thinking about a systemic reset right now. So much in this context can be thrown, out the window in terms of how it's always been done. And we know, I mean, there's data out there about housing individuals and what an investment in doing that translates into in terms of savings, for the local economy, and less stress on our healthcare system, less stress on our criminal justice system when individuals are safely housed in either a supported model or something like that. So I hope that we look locally at what other cities are doing. Like there's, I can't remember if it's San Diego or another one in California, where the city bought out a couple of hotels and turned it into supported housing. And as we're, I don't know how well our tourism industry is going to bounce back. Maybe that's the time for a creative project like that. I also think that we need to look more closely at our transportation system, childcare options, the things that make people's lives just a little easier when they have other things to struggle with. And I know there's efforts underway, with our transportation system, but let's really make sure we're filling gaps, that it's available for all shifts and all days for people who are working, and that childcare centers might be along those lines of transportation for people, so that they're not have to drop off a kid somewhere and then go to work, and then can't work Sundays or can't work the second or third shift because they don't have things. So these are the types of things I'm thinking about.
Excellent. Dr. Moat?
Yeah, I think just to extend that, housing is probably one of the most major issues. One, it's kind of hard to think about how we're going to be beyond this, because we're in this for quite some time, because we still have no sense of a vaccine or process to even provide that vaccine across population, if it was even found yet, right? And so the more we endure this, the more people are going to be impacted, definitely within housing. And so I think a city like Santa Clara that has extended eviction, and so that's one sort of process. And then other spaces are trying to move towards rent abolition, because at least if housing becomes less of an insecurity, there are other things that then can now fall into place. It's not a complete fix, but housing is so, vital in so many different ways. Also in response to, I think, some of the questions that are in the Q&A, I think there is not a way to move to some process of reconciliation without truth. And so I know the question was posed about, can anything about deconstruction, restructuring be done without reconciliation? The piece about removing lethality and stuff like that, I don't think that's even a part of a process of reconciliation. That's just, approaching or getting into the truth aspect. And Coach Lee has sort of alluded to this with, we have mounds of empirical evidence of these types of these disparities, and so they're not confronted, right? We don't have we don't have a process in which we've ever seen a city council actually look at data, right? I'm not in Bloomington, but I'm sure it's like everywhere else where very few people are sitting there who are in city council, who are in city government, truly looking at data and sort of making decisions for that data. So looking at the amount of times in which somebody was arrested and resulted in their death, or how many times people have been displaced after a new development, and so it's there. And so I think we can get to reconciliation without truth, but I think truth is difficult unless lethality is sort of removed off the table. Because confronting truth is going to be a very difficult process. We're going to have heated conversation. If above somebody's head is still like, if I raise my voice, I may be killed or, arrested, that's an issue. And so removing that off the table allows us to get to truth. So at least that's my response, one, to your question, but also to the sort of specific question and answer that was posed to me, and I hope that was helpful.
Thank you. And that was a response to a question by Beverly Calendar Anderson. I'm not sure everyone has access to the questions, so thank you for that. Dr. Simon, do you have anything to add?
So if I'm following right, the question is, what are things that can be done at a local level? And
yes.
Okay, so I have two things. One, to echo what Rasul said about data, keeping eyes on data. There are just tons of sources of data. Now, every data source has its problems too, but there's, in the day and age, so many new ways of drawing on what's actually happening to try and see what are the gaps, what are the trends and gaps, what are all of the areas that could, just informing any discussion based on data. The second is thinking about what might be the new normal as we emerge from this crisis, is that there's certainly going to be a lot of things we don't go back to. And so as a community, thinking about how can we position ourselves to be very on the forefront of what are the kinds of work. So go back to jobs and employers, thinking about what is it that we're going to have as our strengths that will draw activity here and make it vibrant, thinking about what, again, workforce needs are, but beyond that, just there are lots of other things of thinking about what are the things people are going to find very important in community ties, in ways that education and work all combine. And so trying to be foresightful in thinking about the things that we're not going to go back to and how we can be making our local community set for that new.
I wonder if Mark has frozen. So I will take the reins here, I guess, and hope he comes back, because he did a great job as a moderator, and I want to thank him. I want to thank our two panelists for joining us. There will be, and I want to thank all of you for being here this morning. There'll be a follow-up email with some things recapped for you. So stay tuned for that. And we welcome your thoughts. We've got this series, and we can plan additional discussions if we want to dive deeper into any one particular aspect of things, or, you know, consider other ways to deepen this conversation. So please don't hesitate to reach out to any of us. Our info will be in that email. And yeah, just appreciate your thoughtfulness, your openness to reimagining things. And we look forward to continuing to engage. Sorry, Mark, I took over, but
I'm glad you did.
thank you, everyone.
Yes, thank you very much to all the panelists, all the attendees, and to the United Way. Very thoughtful discussion, and look forward to continuing on from here. This is normally where I tell everyone to go grab some coffee and a Danish before they leave. I'm sure you can find some in your own kitchen, or maybe not. So at that, I will. I wish you all well, and stay engaged, and we'll keep in touch. Thank you.